Hello, I'm Dr. Gary Kracoff, Doctor of Naturopathic Medicine and pharmacist at Johnson Compounding and Wellness Center in downtown Waltham. I'd like to welcome you to the second edition of Staying Healthy Naturally, a show that focuses on natural ways to help you optimize your health and wellness. Today, our show is about healthy aging and how to protect yourself against cognitive decline. I'm very pleased to welcome Dr. Thomas Shea. He's a professor, researcher, and director of UMass Lowell's Center of Cellular Neurobiology and Neurodegenerative Research. His work has led to a critical discovery about nutrition, age-related memory issues, and Alzheimer's. Dr. Shea, thanks for joining us today. And can you give a little bit about your background and how you came about to be studying this?
Thanks. It's a pleasure to be here. I've been studying brain health for 30-something years. I started at McLean. Actually, I started at the Shriver Center in Waltham, Massachusetts, part of Harvard Medical School. From there, I went to McLean Hospital, which is also a psychiatric unit, also part of Harvard Medical School, for basic research. And while I was there, we began to study pathways that keep brain cells healthy. Brain cells are a little different than the rest of the cells in our body in that you have to keep them your whole lifetime. Our skin cells are replaced, the blood vessel cells are replaced, our liver is replaced. Brain cells are there from infancy all the way to old age.
And we don't replace them as they get damaged.
We don't. Now, that's a bit of, it's not entirely accurate. There are stem cells, and there is some minor replacement of brain cells as they age. And others can take over the job of some that have dropped out. But by and large, we've got all we have, and we don't get any more.
So it's important for us to do everything we can to protect them and baby them.
Most certainly is. Baby them right into old age. So we were looking at basic pathways that kept brain cells healthy. It became obvious that some of those very healthy pathways are the things that started to unwind, leading to brain cells degenerating and dying. From McLean Hospital, I moved to the University of Massachusetts about 20 years ago.
Okay.
The beauty of UMass Lowell is it has a clinical nutrition department, nursing department. It's a very diverse community. And in discussing my research with some of the nutritionists, it became obvious that vitamin supplements and other supplements were actually going to do a better job of keeping brain cells healthy than some of the chemicals I was using.
So that's very interesting. So what I'm hearing is that Mother Nature really gave us what we need to help protect the brain cells.
In a very real way, yes. In every single case, no. Medicine is still important. Certain drugs are important. But in a general case, or underneath any prescription, good nutrition, good supplements and vitamins are essential to keep that brain cell even receptive to a medicine.
So are we, in your research, are we talking about megadoses of nutrients?
Not at all.
Just enough so the body can perform the duties it needs to?
Well said. Just enough and a little extra.
Okay.
So that you've always got a little more. Some you hear every so often in the news of a problem with a vitamin. That's from somebody megadosing. That's too much of a good thing.
Okay, so this leads into my next question. The standard American diet, our lifestyle, how does that affect our maybe chance of developing Alzheimer's, or even just as we age, having memory issues?
It affects it tremendously. We're living longer and longer. We're living almost 3 lifetimes worth of the time we'd live were we still animals in the wild.
Okay, can you expand on that a little?
I was already planning to. If you look back just several hundred years ago in Europe, people lived 25 or 30 years of age. Animals on the planet, by and large, and we have to obey all the biological rules of animals on the planet, even though we think we're smarter and prettier. Some of us are, some of us may not be. But animals tend to live until they have their children, and they live that number of years again, and then they do an amazing thing. They die and make way for new animals. Okay. We've changed that, and we no longer, what that would mean for us, we pass away 25 to 30 years of age. And now we live another 25 to 30, and
even
another,
more.
and another, 90, 100 years of age. All of that time allows for things to go wrong. Think of a car where you don't replace a certain part. In our case, the part of the car we don't replace is our brain. It gets old and tired, and like you said, it has to be babied. Our diet is no longer the optimal diet, and our lifestyle is no longer the optimal lifestyle. In terms of diet, the so-called Western diet, which is lacking in sufficient vegetables or very fresh vegetables, lacking often in fish, in nuts, in fruit. It's the opposite of what you've heard of as the Mediterranean diet. And some people ask me, does that mean my food has to come from the Mediterranean? No, it doesn't. But think of a European diet that is rich in fish, rich in vegetables, rich in fruit and nuts, and very fresh fruit and nuts and vegetables, which are loaded with good nutrients.
And good antioxidants,
Yes.
omega-3s.
Yes.
And this is one of the problems, even if we're buying organic food, the soil in this country is depleted. We're not going out to the backyard and picking and bringing it in and eating. Even the fresh fruit and vegetables sometimes are a week or 10 days old.
Exactly right.
And the minute it's picked, the nutrient level starts going down.
Well, and the converse, when we were very new on the planet, the very first creatures you could identify as a man, we acted very much like other primates. We were wandering through the forest as small tribes, picking stuff and eating it immediately.
And we were
Picking
physically
vegetables.
active. And
Always
eating
active, always moving.
Okay, so I take it the foods in the standard American diet probably are severely lacking in the nutrients you discovered that are very protective to the brain.
Yes, they can be in many people's diet. I like to take a little step back and say that you don't need to completely obliterate the Western diet. You can have red meat. You can have meat and potatoes, just please
Everything
not
in
7 nights a
moderation.
week.
Yeah.
Get some fish into your diet. If some people say, it amazes me, but some people say, I don't like the taste of fish.
They probably
Well,
haven't had real fresh fish.
They haven't had real fresh, and there's a point along those lines in terms of farm-raised fish. But then have an omega-3 pill to get some of the goodness of fish into you in your diet.
Good idea, good idea.
Farm-raised fish is nowhere near as nutrient-rich as wild-caught fish.
Well, that makes sense. The wild fish are out swimming for
They are.
survival. They're eating a
Exactly.
varied diet, whereas the farm-raised fish are getting fed what they're getting fed. And originally they were feeding them cornmeal.
Yeah.
And I don't know too many salmon, wild salmon, that ate corn in the wild.
I challenge people, buy a piece of farm-raised salmon and a piece of wild-caught, take them both home, cook them, pass them out to everyone eating. Just ask them which tastes better.
And also the wild, you need a much smaller piece. It's much more satisfying and because it's
Exactly
nutrient
right.
dense.
Definitely.
Same thing with the free-range chicken or the grass-fed beef. It has all the nutrients you need, so you don't have to eat the pound piece of steak. A much smaller
Right.
piece is very, very satisfying. All right. Moving along, I'd like you, if you could, people are hearing a lot about beta amyloid plaque and whether is that the cause of memory problems or are leading to Alzheimer's. There seems to be some correlation of an increase in plaque and an increase in memory issues. Can you?
There definitely is. Beta amyloid is not necessarily the initiating agent.
Okay.
It may, in fact, be brain cells trying to protect themselves or their neighboring brain cells. And an analogy, it's not my own, was Dr. Mark Smith described beta amyloid. How could it possibly be protecting when it causes so much damage? He said, think of your house having a fire and the firemen come in and they chop down the door and they cut into the walls and they do a lot of collateral damage, but they may save your house.
Okay.
Beta amyloid can be like that. Something's gone wrong, and you mentioned it, with oxidative stress. And the cell tries to respond. Unfortunately, in its response, it sets up a cascade of further oxidative damage.
Okay. So do you have a visual of something?
I certainly do.
To
Now,
help show that?
Beta amyloid eventually makes a thing we call a plaque. And what's a plaque? If you look at a section of the brain, it's very smooth. In an individual who has suffered from Alzheimer's disease, if you take a section of that person's brain, there's often there can be dark collections or spots, and they're called plaques. Maybe perhaps like an age spot on otherwise clear skin.
Okay.
That plaque has arisen from a bunch of little pieces of proteins that have coalesced and hardened. Now, where did the proteins come from? Here's my visual. Cells in our body are like soap bubbles. They're made of lipidy material. They have water inside, and there's usually surrounding outside water, be it blood or the fluid in our intestines and so on. So picture a soap bubble, and I'll enlarge it in a minute, that has an inside of fluid and an outside of fluid. Now let's do the soap bubble like this. All cells, including brain cells, communicate with each other or carry out complex reactions by having proteins that span the surface of the bubble. So there's a piece of it inside and a piece of it outside. And sometimes the outside piece helps that soap bubble interact with another soap bubble, keeping your cells stuck together.
Okay.
Well, beta amyloid arises from a wonderful, perfectly natural, very important protein that exists across the membrane in our brain cells. Now, we make new proteins and we get rid of old proteins all the time. To get rid of old proteins, we cut them into little pieces. And I'm trying to do it gently so I don't shatter the whole thing. And then take them into the cell and put them in what's the little garbage bin, or they float away outside and go to our kidneys and are disposed of. In the case of Alzheimer's disease, we start to generate too many fragments of this protein that used to live in the middle of the membrane. I'm putting the little yellow piece back on. These fragments, there are too many of them. How do you get too many of something? How do you have too much broccoli in your kitchen or too much stuff? You either brought too much in or you didn't take out the trash. So it is a combination of both, and you can't exactly say there's too much present. Some of it from making too much, some of it from not cleaning it up.
And as an aside, that can also be due to our lifestyle. If we're stressed, if we're not eating well, if we're not getting enough sleep, the body can't take the garbage out, can't clean up the mess.
It doesn't clean up enough. So here we've got an excess of little fragments of what was once a very important protein. Now, a few of the fragments are important and may be used for one cell to talk to another. But when there are too many, they float around. I don't know if you can see, this little thing that held it connected to its buddy is pointed, and it pokes holes in other brain cells. It damages other brain cells around it. Eventually, it coalesces to form a plaque. But until
what has happened
on the
up to
way,
that point?
it's poking holes in things. It's activating other portions of brain cells that shouldn't be activated.
So that, if I understand correctly, then starts causing damage to the cells so they don't function at the level that they could have functioned, which then could start causing the memory issues.
And so a brain cell not talking to another because it's injured blocks the chain of command. Just like a telephone wire, if you cut it, you can no longer...
Or that game we used to play where I would whisper in your ear, you would whisper in the next person, and when it comes around, it's a totally different message.
So it's true. Once it's made a plaque, it's out of play. It may not even be injurious to us all, like hardened concrete.
So the beta amyloid plaque may not be causing Alzheimer's.
On the way.
It's the trip to get to the plaque that could be causing.
So some of the beta amyloid did it, and there's also damage beforehand. And beta amyloid triggers other problems along the way to making its plaque. The plaque is evidence that a chain has gone on.
All right. Thank you. That made it much easier to understand. Another question I have for you, I guess to address some of the nutrients that you found that work, that we don't need in megadoses, if people are reading in the paper or going on the web and all that, what's good for memory, you would probably have about 40 or 50 bottles lined up and be filling up your stomach with all these different good supplements for the brain. What do you feel as a researcher are some of the key nutrients that can be beneficial along with lifestyle and diet?
Right. Starting with a great diet and a lifestyle that keeps your brain active and your body active, a multivitamin to make sure that you're not missing. If you're missing one vitamin, you compromise everything else. So let's talk about those as a baseline. Then on top of it, there are key supplements that are very important for brain cells. These supplements are important for all of our cells, but we already pointed it out. If a brain cell has to last 70, 80, 90 years, you can't afford to slack off at all. And the basic pathways that keep cells alive and spinning, they're inside brain cells as well. There's a key metabolite. It's called S-adenosylmethionine, or I'm going to call it SAMe for short. It has a big, scary chemical name, but remember, vitamin E's big name is alpha tocopherol.
Right.
So this little guy, SAMe, his job is to keep all of the cell in balance.
Okay.
It has some antioxidant properties. It wraps our DNA and protects it. It helps us build our neurotransmitters. It actually takes antioxidants and makes them bioavailable. So we make antioxidants, but we also have to use them. The word bioavailable is more well known now than it used to be. That's a pivotal metabolite. It's found in broccoli, it's found in vegetables. The problem is, to get enough of it without supplementing it, you have to eat a lot of broccoli and very fresh green vegetables.
Yeah.
And
so what I'm hearing is that it isn't this nutrient protects the brain and prevents damage. It's really a balance. Giving the body, you hired a mason to build a wall, and if you don't give them enough bricks, you're not going to get the wall, but you don't need twice as many bricks.
You don't need twice as many.
You need a little bit more in case some of them get wasted.
And the cement and concrete that holds the bricks together in the right amount and fresh enough. And
so what other nutrients?
Other nutrients, general antioxidants are very important.
Okay.
Folic acid, vitamin E, the B vitamins are very important. What we see in studies many times, or you'll see them in the newspaper, is someone will try just folic acid.
That never
works. Does
works.
this help? It can work for an individual, but that individual has to have everything else in place, and you add some folic acid.
Right.
Very hard to get a handle on that. It's really a combination of vitamins and nutrients. So antioxidants plus energy, plus something that mobilizes the antioxidants, and basic building blocks that keep the cell healthy, like SAMe, to be receptive to antioxidants.
Okay, excellent. And so going along that route, what I'm hearing is almost a caution. So if this amount of SAMe is helpful and you think your memory is off, taking 4 times the amount isn't necessarily helpful.
Exactly
Looking over
right.
some of your research, if I interpreted it correctly, you found when you used a certain combination of a few key nutrients, you hit upon the right mix and it worked great. When you doubled it or raised one of them much higher, it wasn't any more
That's correct.
effective.
That's
so it's
correct.
really getting the proper mix.
Yes. And we developed a formulation, we got it right in balance, and it kept brain cells healthy in culture dishes. It worked very well in the clinic for memory. For adults with no known or suspected memory issues, it gave them a boost. For individuals with early cognitive decline, it gave them a boost back to normalcy for a time, for years. Some of these nutrients, it's known, not from our studies, but in other studies, yeah, X amount of that was great. Well, shouldn't I take 10X? It still works, but it leads to liver damage down the line.
And that's one of the problems we find is if a little bit or the right amount is helpful, let me double up because I want to get there faster.
Yeah.
And if you give the body more than what it needs, it's going to be using a lot of its repair energy to get rid of the excess, as opposed to then you're using the product or the nutrients even in a worse way.
Early on, I mentioned, as an analogy, a kitchen with too much broccoli. You brought too much in.
You have to take
broccoli
it out.
is wonderful, but if you have 10 times more than you can use, it's in the way of doing everything else. And like you said, you need energy to push it out of the way.
Some of my clients have used the mix from your research. And what I find interesting, that some of the people that had severe memory issues were doing better and felt better. But what I also noticed when it was a couple, a husband and wife, the wife usually has the husband take it, and a month or two later you ask them, how is he doing? And he says, I don't notice any change, and the wife is standing behind.
Yes, it's changing.
And a lot of people find that the husbands aren't asking the wife the same question over and over again, because one, we're hearing the information and it's logging in better. So that's great. So your research isn't just on Alzheimer's, it really could be helping all of us as we mature to maybe slow down that process, so when we hit 80 and 90, we're not missing too many brain cells.
Exactly right. you lose brain cells as you age. So a certain amount are lost every day. And there's very little we can do about that. And again, that's a consequence of us living so long.
Okay.
However, with an inappropriate diet or an insufficient diet or lack of mental stimulation, you lose more than the person who's doing their best.
And that probably is due to lacking certain nutrients, but also when we eat a lot of processed foods, we're under a lot of stress, we're generating a lot more free radicals.
Yes.
And those are just little atomic bombs bouncing around, damaging proteins all through the body.
A free radical, the way I like to explain it, we burn our food just like a log in a fire. We do it on a molecular basis. If you take a bite out of an apple and set it down, it turns brown. It's burning. It's oxidizing. That same process happens to our cells if we don't have enough antioxidants. Free radicals are unbalanced molecules. Most people know a molecule, an atom, consists of protons and electrons. Well, if I take an electron away from an atom, that atom's not going to be happy till it gets its electron back. And it's going to take it from anything it can find, including our DNA or our cell membrane.
Okay.
So we can accumulate damage over the years. And what's the cell that's been sitting in me my whole life? A brain cell. So it can accumulate more and more damage. For an individual with cognitive decline beyond simple age-related, they lose even more brain cells.
Okay.
And coupled with that is our genetics. We're all different. I may not make as many antioxidants as you make, or I may make a weaker form than you make.
So then your diet would be even more critical, and you're balancing stress and managing that.
Yeah.
Also, sleep is very important.
Yes, it is. Give us a chance to regenerate.
Because that's when the body does its repair work, and if we're not getting enough sleep, the whole machine falls apart.
Right.
Okay. Well, this has been very interesting. So I guess to sort of tie it together, there isn't a magic bullet. It's nutrition, lifestyle, getting the right nutrients in, probably, let's talk a little bit about exercising the brain. Somebody said to me once, I'm right-handed, so I always put the key in the lock in the door in the garage when it's dark with my right hand. I can close my eyes, get it in, and open the door. They said, start opening the door with your left hand. And it took me 5 minutes the first night. I had to put everything down, line it up. Now I can do it. Same thing, people who love crossword puzzles should start doing some numbers games. And people who do numbers should do, how does that work? Does that help rewire the brain?
It doesn't rewire it completely, but the brain is not a muscle, but it must be exercised like a muscle. What happens when you exercise physically? Your muscles get bigger. If you stop exercising, they shrink back to where they were, or even worse if you stop too long. We have a variety of brain cells. Some of them, for example, run our heart. Some of them let us breathe. Well, our heart beats automatically, and we breathe automatically. We can breathe heavier, but we have an automatic approach. If we're winded from exercising, we'll breathe heavier. Inside the middle of our cognitive power, the stuff where our intellect goes, our memories, our thoughts, there's a little central area. Its name is the hippocampus. But I want you to think of it as a central switchboard.
Okay.
And all the information coming in goes to it and goes to the filing cabinets in our brain. And all our memories in the filing cabinets come back to that little spot and we can think of them again. That little portion changes every day. It's changing for everybody listening to us now. Anyone who's learned a musical instrument knows when you start to learn it, it's hard and it starts to get automatic. What you've done is
all of a sudden it clicks.
You've made those brain cells get their little connections bigger and stronger by training them. And you remember it. So it's very important. Your heart, the brain cells that run your heart will keep on going. And in fact, someone who's in a coma, their heart keeps beating often. The ones that allow you to think and remember and feel and love, those have to be trained and exercised to keep them going. They work hard every day, but you have to keep them by exercising them, and they'll last into your old age.
Well, this has been wonderful, and Dr. Shea, I want to thank you, one, for your knowledge. I think you really helped the audience, and two, for your research. I hope you're going to keep going, because I'm sure we're at the infancy stage of this, and for bringing all this information out to the general public. And I want to thank all of you for joining us today. And please join us next month for the next edition of Staying Healthy Naturally.